Welcome back to the Morning Blend. The pandemic is stressful, and for moms-to-be who are already worried about having a healthy baby, the anxiety can really be serious. Today, some suggestions to feel better. Sarah Orntz-Bloomquist is with the Mom's Mental Health Initiative. Hi, Sarah.
Hello.
Great to have you joining us. Thank you so much. I think that it's for people, just average people, they're feeling the effects of the pandemic. And then I think about people who are pregnant and their goal is to have a healthy child. And then also women who've just had a baby and been through the process, that postpartum period. It must be especially tough, the pandemic and the shutdown on them.
It is. It's obviously we're all going through this global trauma, but it's affecting women who are vulnerable in that perinatal period even more. Women in their reproductive years, especially in that perinatal period, are more at risk for anxiety and depression and mood issues that can accompany that. And then this just adds a whole extra layer of risk for them.
So specifically pregnant women, what are the kinds of concerns that they're having right now?
Well, there's multiple concerns. So some of them would be just like, what is my birth experience going to look like? What will my labor experience look like? So hospital policies and guidelines are changing rapidly based on, the status of the pandemic wherever you're living. So they might not know if they can have their partner with them or if they can have their doula. And then other issues are, well, what if I test positive? Will it affect my baby? Will I be able to be with my baby after I have it? And we're seeing, in some situations where parents aren't allowed to be with their baby when they're in the NICU because of lack of social distancing or lack of PPE. So there's a lot of unknowns and just this constant state of unrest. Plus, we're doing virtual meetings with our providers. So just not having as easy access to your provider, I think, can be frustrating. And then we're dealing with isolation. And isolation is one of the leading causes of perinatal mood and anxiety disorders, such as postpartum depression or anxiety. So that isolation factor during pregnancy and even after. And what research is saying, what the CDC has come out and said, is that pregnant women are 3 times greater at risk for complications and hospitalizations due to COVID. They're not at a higher risk of death, but they are definitely at a higher risk for severe complications. And so sometimes women are having to deliver early because of being positive for COVID. So it's terrifying, but at the same time, there are some tools and steps that families can partake in to help ease some of that anxiety.
Can you share some of the ways, some of the suggestions you have to help them get better?
Sure. So, without a doubt, you need to have a strong support system. And so that means knowing who in your support network is somebody that you can really release to and share with. And it might have to be online or on the phone, but really having somebody that can just hear you out, be that support. It's also important to be proactive. So if you have this vulnerability to anxiety or already experience it, talk to your provider and look at maybe getting connected with a therapist or a counselor. That's one of the things that we like to help moms do, is find somebody who really understands that perinatal period and can help work with them. Stay off media, at least sensationalized media. And then take the proper precautions. Wear a mask, wear a mask, wear a mask. Also, try to stay socially distant. Just don't do those things that are going to increase your anxiety about getting COVID. And so there's also a lot of online support groups out there right now. We connect a lot of moms to some other organizations that are offering these online support groups. So, it's kind of like, be prepared, but don't get yourself too worked up about it. I don't know if that makes sense, but it's kind of like be prepared, but be flexible. There's going to be changes. Just know that your birthing plan, your labor might not go as you wanted, but you can adjust and you can adapt, and you really need to keep your expectations in place.
And that's one thing you get a lot of help with is the labor and delivery process. I know from experience. So that's one thing that people can rest assured about is you're going to have a lot of help. Thank you so much for joining us today. Appreciate your time.
Thank you.
Yeah, absolutely. And people can get in touch with Mom's Mental Health Initiative. You can go to momsmentalhealthmke.org, or you can email this address for more information to its info@mmhimke.org.